Hello, my name is Dr. Lakshita Gupta. I'm a second year internal medicine resident at Western Eye Medical Center. Today we will be talking about an endoscopic retrieval of accidental foreign body ingestion. While foreign body ingestion is uncommon in healthy adults, clinical cases involving ingestion of foreign bodies are prevalent in the hospital setting. While most ingested foreign bodies pass spontaneously, ingestion of sharp objects could become impacted and cause bowel perforation, which typically occurs at the ileocecal valve and less commonly at the retrosigmoid junction. Small bowel obstruction could also occur with objects larger than 6 centimeters. Upper endoscopy is an established method for retrieving sharp objects in the esophagus. However, when foreign bodies are located beyond the reach of the endoscope, management becomes ambiguous, with limited studies to demonstrate the safety of sharp object removal with colonoscopy. Meanwhile, recent studies have shown that colonoscopy can be helpful in removing foreign bodies from the cecum, terminal ileum, and ascending colon. We report a case in which an ingested foreign body adjacent to the appendix was successfully retrieved using colonoscopy. So this case is about a 39-year-old female who presented with progressive and intractable right lower quadrant abdominal pain, which was associated with nausea secondary to ingestion of the ball portion of her tongue piercing. Routine labs were unremarkable. On physical exam, abdomen was soft but tender to palpation in the right lower quadrant. No rebound, guarding, or signs of peritonitis were present. Abdominal X-ray revealed a round metallic foreign body in the right lower quadrant and benign bowel gas pattern, as we can see in figure 2. CT of the abdomen and pelvis without IV or oral contrast revealed 1 centimeter round metallic object in the right lower quadrant. We can see this in figure 1A and B. Decision was made to retrieve the foreign object via colonoscopy. Colonoscope was advanced to the right colon. Circular, non-impacted metallic object was located adjacent to the appendix. Roth net retriever was used in extracting the metallic object. We can see this in figure 3A and 3C. Retrieved object was consistent ball portion of the tongue piercing. Colonic mucosa was otherwise normal. The patient was closely observed and subsequently discharged from the hospital without adverse events. Foreign body ingestion causes abdominal pain, nausea, and vomiting, which are common clinical presentations in the hospital. Commonly ingested objects are food boluses, buttons, coins, batteries, toys, and sharp objects. Most ingested foreign bodies pass spontaneously without needing any form of surgical or endoscopic intervention. However, there is still significant morbidity and mortality associated with retained foreign bodies in the United States. Ingested foreign bodies are mostly found in the upper esophagus, middle esophagus, stomach, pharynx, and duodenum. Sites of impaction include duodenal loop, duodenal jejunal junction, appendiceal lumen, colonic flexure, cecal ascending colon junction, and terminal ileum. Aside from abdominal pain, patients can present with dysphagia, odynophagia, chest pain, and signs of small bowel obstruction. Clinicians must maintain high index of clinical suspicion when patient presents to the hospital after ingesting a sharp object. Risks associated with sharp object ingestion include perforation and bowel obstruction. Trauma to the intestinal mucosa secondary to obstruction could result in peritonitis, abscess, and fistula formation. Endoscopic removal of these objects has high rate of success and leads to few, if any, complication, and it's also known to cause reduced hospitalizations. Timing of endoscopic removal of foreign body depends on the type of object and site of impaction. While most foreign bodies lodged in the colon are managed conservatively, several case reports have demonstrated successful use of colonoscopy in retrieving foreign bodies from distal duodenum, mid-ascending colon, and terminal ileum. This case further demonstrates the effectiveness of colonoscopy in removing foreign bodies from the colon without adverse effects and need for further surgical intervention. Thank you.